Environmental endocrine disruptors and reproductive disorders. An endocrine disruptor is a chemical that mimics or blocks the action of the natural hormones in the human body. Natural hormones are powerful chemicals secreted in minute amounts by the body's endocrine glands, which include the pituitary, the thyroid, the pancreas, the adrenal glands, the ovaries, and the testes. In the body, minuscule quantities of natural hormones control the whole range of growth, development, and reproduction, from prenatal development through adolescence, adulthood, and old age. Hormones are released into the circulation at precise times during development. They are extremely powerful chemicals. It is very worrisome that there are now scores of man-made, synthetic chemicals that can mimic and compete with natural hormones in the bodies of up to 90% of the world's population. In thinking about the possible effects of these endocrine disruptors, it is important to remember that the amount of a natural hormone needed to get the job done is infinitesimal by any standard. Therefore, the very presence in the body of low concentrations of synthetic chemicals that can mimic the actions of hormones is sufficient to cause serious concerns. There has been an explosion of interest in recent years in the developmental consequences of early life exposures to chemicals that function as endocrine disruptors. Some specific examples of reproductive and endocrine disruptors are as follows. Bisphenol A, BPA, is an endocrine disruptor used as an additive to polycarbonates and epoxy resins found in the plastic lining of food cans, in plastic tableware, in medical equipment, in toys, in food storage containers, in water supply pipes, and even in baby bottles. BPA can leach into the environment or into foods or liquids stored in containers with BPA in them. Recent research shows that exposure to BPA prenatally and in early childhood is linked with aggression, hyperactivity, obesity, increased risk of cardiovascular disease, diabetes, and reproductive abnormalities that range from early puberty to sexual dysfunction and decreased levels of normal hormones. Phthalates are endocrine disrupting chemical compounds that are added to plastics to make them more flexible. Nearly all PVC products contain phthalates to make them more pliable, soft, and flexible. As the PVC ages, the product loses its plasticity, yellows, and becomes brittle. In fact, the yellowing is a visible marker of the leaching of the plastic's phthalates into the environment and consequently into our bodies. Other types of plastic and many other products contain types of phthalates that help them retain their color and scent. Phthalates are in widespread use in air fresheners, shampoos, perfumes, and cosmetics. The compounds do not stay in the products, and they dissociate themselves easily from the product and move directly into the wider environment. People everywhere across the globe now have phthalates in their bodies in measurable and worrisome amounts. Prenatal exposure to phthalates has been linked to shortening of the anogenital distance in baby boys, a finding indicative of decreased masculinization of the reproductive organs. This appears to be linked in adult life with lower sperm production and infertility. Neurodevelopmental changes are seen in later childhood, with feminized play in boys and attention deficit and aggressive behaviors in boys and girls. Overall, boys are more affected by phthalates than girls. Copyright Academy House www.academy.house